My name's Jeff Davick. I'm originally from Iowa. I grew up in eastern Iowa, went to undergraduate at the University of Iowa, and then went to medical school there. After medical school, I went to University of Nebraska for my orthopedic training, and then I did my sports medicine fellowship at University of Wisconsin. Finished in 1994, a long time ago, and I've been here ever since. I chose orthopedics because of the variety. We have both a variety in patients that we take care of, young patients, pediatric patients, young athletes, college athletes, and people as they age and mature. The other thing I like about orthopedics is that we can take care of people both surgically and non-surgically. And even though it is orthopedic surgery, there's a lot of patients that we can help without surgery, and that's rewarding as well. Well, for a new patient whom I've never met before, I like to start with an open-ended question, ask them to tell me about their shoulder, tell me about their knee. I think that gives me a better feel for what they might be looking for. Some patients just need some education and some reassurance about what's going on in their body. Others want to talk specifically about the treatments, and then I think my role then is to educate them as far as treatment options, talk about the pros and the cons and the benefits of each, and help them make a decision on what's best for them at that certain time. For established patients that I've already seen, I always like to try to remember something about them, especially a lot of the young athletes that I take care of. I just get a kick of reading about them in the paper, looking things up on the internet. You know, what place did you get in state in wrestling? How's your football team doing? How many yards rushing did you have last Friday night? And I just like visiting with those folks when they come in about those issues. You know, in the medical field, and even outside the medical field, just taking care of people. I mean, we're privileged to be able to have people walk through our door. We can serve them, take care of them, help them get better. And then trying to carry that outside the office a little bit too, and outside the hospital. There's all sorts of volunteer opportunities in our community and even outside our community that I've been blessed to be involved in. One was a group called Mission Jamaica, and we worked in a clinic in Jamaica, helped build a second clinic in Jamaica, and just to go down there and see the people, take care of them, talk to them. People always say you get more out of those situations than you give, and that's certainly the case for me. There have been some sports camps and a large Christian sports camp that I volunteered at too in Missouri, and that's just been fun working with young people, working with the young counselors, not only medically but outside of medicine as well. For me, my in orthopedic sports medicine being a subspecialty was interesting to me just because of my involvement in sports growing up, and I still love sports. I like going to high school football games on Friday night, being on the sidelines, standing, alongside the coaches and the players. It's just fun. I mean, it doesn't feel like a job to me. It's something that I have a passion for and I really enjoy. As far as the training of sports medicine, and I've been fortunate enough to work with some primary care physicians that are excellent primary care sports doctors, so they'll take care of a lot of the non-orthopedic issues. As far as my training in orthopedics and sports medicine, I did 6 months of knees and 6 months of shoulders. But also took care of some of the University of Wisconsin teams, and we did all sorts of sports medicine care, both operative and non-operative, and outside the knees and shoulders as well. Well, a lot of the non-surgical things we do, like for athletes, a lot of times are during the season. Try to get them through the season, have them play and perform safely without re-injury or furthering their injury. And a lot of that we do in combination with the athletic trainers that we work with and the physical therapists. Well, here in Des Moines, we have the opportunity to take care of a lot of different athletes. Various high schools in Des Moines we cover as a group. Simpson College I've been associated with for just over 20 years. What I like about Simpson College and the small college is that they are truly student athletes. They're students first, athletes second. There's not as much pressure as like a Division I school as far as getting them back on the field or getting them back on the court too early. We can just take care of folks. They have athletic training programs, so the informal teaching with the student athletic trainers is fun. Down in training room, we'll kind of go table to table. A lot of the students follow me and can do some on-site teaching. The athletes are very good about, their classmates of theirs, so they're going to allow them to learn how to do a good knee exam, a good shoulder exam, how to do the appropriate rehab after surgery as well. So just take care of young athletes, motivated people that want to get better. And also in Des Moines, we have the opportunity for other sports. The Men's Soccer Club is one that we work with closely. Those athletes are fun. They come from all different colleges and kind of congregate in Des Moines for the season. In the summer, some have gone on to play in the MLS and excellent athletes, very fun to take care of. We've also kind of coordinated some of the Junior Olympic events when they've been here in Des Moines as well. So there are a lot of different opportunities. Even the U.S. Senior Open, when it was here, we're involved in some of the medical care there. So Des Moines lends itself to a lot of different athletes, and again, a wide variety of even young athletes. I've talked at soccer clubs and wrestling clubs for the younger athletes all the way up to senior athletes. Well, when I deal with athletes, there's I think one of the easiest ways to talk to an athlete going through surgery and going through a rehab is I always try to stress to them the difference between an injury and rehab, that there are certain things that athletes are required to push through, certain amounts of pain, endurance, things that they have to push through that aren't always pleasant. But when they're recovering from surgery, it's my job to say, this isn't the time to be tough. This isn't the time to push through pain. This is the time to listen to your body, to rehab your body. And I look at a lot of athletes and I say, part of being a good athlete is knowing how to take care of yourself, how to take care of your body, how to follow the instructions that either I give you or the physical therapist, and not to push too hard. So a lot of it is dealing and helping them deal with, how hard do I push? How do I know if I'm pushing too hard? When am I hurting myself? And how am I making myself stronger? My wife Christy and I just celebrated our 36th wedding anniversary, and we're blessed to have 5 kids. Not by my design, but 4 of the 5 went into medicine, so I've somehow become kind of a medical family. My 2 daughters are nurses at the hospital. My 2 sons are both physicians, and my oldest daughter is married to a physician. So some of our conversations at the dinner table, I'll look at Christy and say, I'm by far the dumbest one at the table.